failure is also one of the common causes of liver transplant being performed. Throughout the world, acute liver failure, the commonest cause is paracetamol poisoning, but other causes of chronic acute liver failure, such as acute viral hepatitis, are also amongst the list. Then there are inborn errors of metabolism, like alpha-1 antitrypsin deficiency, Wilson disease, tyrosinemia, and galactosemia. Patients have liver transplant for these disorders also. Primary sclerosing cholangitis, hepatocellular carcinoma, as we discussed earlier, Budd-Chiari syndrome, polycystic liver disease, and of course now cholangiocarcinomas also. So we discussed already that the two types of liver transplants are deceased donor and living donor liver transplants. And the advantage of the deceased donor is that you have a whole liver available, and there is no limitation to the amount of tissue that you need for the recipient. Whereas in case of the living donor, you have to leave enough tissue in the donor, which is enough to survive the donor himself or herself. Whereas you also at the same time you need enough tissue for the recipient also, so that it can take up the workload for the recipient's body. What are the contraindications for liver transplant? Active alcohol use is a contraindication. Uncontrolled sepsis or infection, uncontrolled extrahepatic malignancy, advanced cardiopulmonary disease, advanced chronic renal disease, and HIV infection. HIV infection is in fact a relative contraindication, it's not an absolute one. So that with that we conclude our lecture.